All right. Good morning, everyone, and thank you so much for joining us. My name is Tiffany Narvaez, and I'm part of the marketing team here at United Ag. Today's topic is COVID-19's effects on behavioral health. Before we get started, I want to give a brief shout out to our sponsors who make all of our programming possible. We have CVS Caremark, Elite Medical, HCP National, Prentel, and Cyan. Thank you so much. A little bit of housekeeping, please be sure to mute yourselves and to remain muted throughout the presentation. And be sure to chat in your questions via the chat feature. We will have a Q&A session at the end of the presentation, and we'll try to get to all those questions. This presentation is being recorded, and we will make this available for you to share with your colleagues and your friends and your family. We do have a poll going, so please be sure to answer it. We want to know how you're all feeling during this pandemic. And we are, both Dr. Ku and I are remoting from home. So if you do hear a dog barking or some jackhammering, please forgive us. But now I pass it off to Dr. Rosemary Ku, Chief Medical Officer of United Ag.
Thanks so much, Tiffany. Hi, everyone. Thank you for joining me today. So I think for all of us, the COVID-19 pandemic has really placed us in uncharted territory. We're all facing a contagion that none of us can see with the naked eye, and that can very much lead to worries about our own health and also the health of the people that we care about and our communities. Also, almost every part of our daily life has changed dramatically. And there's a lot of uncertainty, and that in and of itself is very stressful. And to make things worse, our normal healthy coping mechanisms, such as going out or meeting up with friends and family and gathering people together, are just not available to us anymore. So this is a very stressful situation for all of us. It can certainly trigger emotional health issues, even for people who don't have underlying conditions. And for people with underlying conditions, it can certainly make them worse. Also, COVID-19, we're running a marathon here. This is not a sprint. And what I mean by that is, unlike natural disasters where there's an event and a recovery period, even if the recovery period is long, you know that the worst has already happened and you can move forward. We're not there yet with COVID. This is still the beginning stages of the pandemic. There are probably still going to be a lot of changes to come. And therefore, for all of us as individuals and as a society, this pandemic is going to be a chronic stress. And while our bodies and minds are actually quite adapted to dealing with short-term stress, we're less adaptive to deal with stress that prolongs over weeks and months. And this type of chronic stress can have a huge impact on people's mental and physical health. And today we're going to be focusing on how to maintain your emotional health during this long process of change and uncertainty. So the main topics that we're going to be covering are your brain on stress. We're going to be talking about emotional health warning signs. We're going to be also talking about tips for how to increase resiliency. And then also I'll have specific recommendations for any of you that may have underlying mental health conditions, or if you know of someone that has any of these conditions. And then lastly, we'll leave a lot of time for Q&A. So first of all, just want to start off with the definition of behavioral health. And SAMHSA, which is the Substance Abuse and Mental Health Services Administration of our government, has defined behavioral health as the promotion of mental health, resilience, and well-being, the treatment of mental and substance abuse disorders, and the support of those who experience and or are in recovery from these conditions, along with their families and communities. And you can tell by this definition that behavioral health applies to everyone. Even if you yourself don't feel like you have a mental or substance abuse condition, you are still probably have someone in your community or perhaps family or friends that may be impacted. And for all of us, resilience and well-being is certainly critically important for overall health. Actually, so out of in the adults in the US, at least half of us actually will at some point in our lives experience some sort of mental health issue. And that's going to increase, unfortunately, with COVID because of all the stresses that we talked about in the very beginning. And a stress is anything that threatens your normal state of being, whether that's physical or psychological. And everyone reacts to stress a little bit differently, but the images here represent the three major responses that humans and other animals have in response to stress. And those are to freeze, flight, or fight. And we've seen examples COVID pandemic here. If you remember when COVID was first coming out, there was a lot of inaction by our governments and public health officials. There was even denial saying that this was just another flu when there was actually data that it wasn't. And then now we're seeing people fight over things like toilet paper. So I would have never guessed that people would fight over things like toilet paper, but it's happening. And these are stress responses. And these behaviors are produced by a cascade of chemicals in your brain, and then your brain ultimately controls what happens in your body. So because of the stress response, your body is activated, and everyone has kind of experienced your heart pounding or sweaty palms or feeling really jittery in response to things like hearing a loud sound or realizing that you might have missed a big deadline for work. Those are, subconscious reactions in your body to stress. And if it's a short-term stress, after the event passes or after you finish your project, your body and your brain can go back to normal, and it's okay. But if the stress is actually prolonged over weeks, months, or years, there are actually changes to your brain structure and also changes in the way that your brain cells communicate. And the reason why I'm explaining this is I'm trying to bring what's kind of subconscious to the conscious so that you understand your emotions that you're having are actually a product of the stress of the situation. And there are basically two major changes that happen to your brain during chronic stress. And the first is there's a structure in your brain called the amygdala, and that actually becomes more hyperreactive. And that's the part of your brain that actually processes emotions like fear and aggression. So say you hear kind of a scratching at the window in the middle of the night and you're all of a sudden you get up and you think that someone is breaking into your house and you have that rush of fear, that's your amygdala. That's the initial gut response. Or say you're talking to a girlfriend, hey, like you look great. Are you pregnant? And you're like, wait a second. I take offense to that. Like are you saying I gained weight? I'm fat? Like kind of, aggressive, hostility, offense type of emotions are all related to your amygdala. That's your kind of first reaction. And when that becomes hyperreactive, it can create excess fear. It can actually trigger anxiety disorders, and it can be a key part in post-traumatic stress disorder. And unfortunately, that's the area of the brain that becomes hyper active in the situation of chronic stress. And then the second change that can happen in your brain in response to chronic stress is a decrease in the connectivity of the prefrontal cortex and the hippocampus. Now, the prefrontal cortex is the part of the brain that's responsible for reasoning. So going back to the example where you hear that scratching at the window and you think someone's breaking in, your prefrontal cortex starts taking in a little bit more information. You listen a little bit more and you realize, okay, it stopped. It's probably not someone breaking in, and you're able to calm down. Same as in the example of, hey, if someone thought that you're pregnant and you're not, your prefrontal cortex says, hey, like, look, this was it was a mistake. That person didn't mean anything bad by it. And you're okay. Your hostility and anger at first can dissipate because of your prefrontal cortex reasoning. But that part of the connectivity actually can go down after periods of chronic stress. So you're actually less able to regulate your emotions. And then the other part of the brain's functioning that can go down in chronic stress is your hippocampus. That's also the area that helps regulate your emotions. But even perhaps more importantly, is that it's related to short-term memory. And so if you have experienced periods of chronic stress, your short-term memory might not be as good, which explains why you might be more, you kind of, might have short-term lapses in forgetting things. You might be more forgetful. You might have difficulty concentrating, and that's because of these changes in the brain. But these changes don't necessarily have to be long-term, and we're going to be talking about tips for how you can actually counteract the stress response in your life so that you can maintain emotional health during this period. First of all, I want to go over some warning signs for when your emotional health is not doing so well. These are distress signs that, should make you pause and say, I need to do something differently. And first of all, a lot of people during stressful times or increased anxiety or depression experience changes in sleep or nightmares. A lot of people also experience change in appetite, either a decrease or an increase in appetite. Excessive fear or worrying is very common. We've already talked about kind of the anger and hostility that can happen in response to chronic stress. And also, as I mentioned, the hippocampus is affected with stress, which causes difficulty in concentration and poor memory. And people also can experience a lot of physical symptoms of distress, including fatigue, body aches, soreness, headaches. And a lot of us have experienced digestive issues, either with constipation or more loose stools than usual. And if you find yourself turning to alcohol or other drugs for coping, that's also a warning sign that you're not doing well and you're not coping as well as you can with the situation. If any of these interfere with your daily activities, like your work or your family responsibilities, then that's the time that you need to reach out to a healthcare provider for more help and support. Um, but before we get to that point, there are things that you can do to make sure that you don't get to that level of distress. Or if you have early signs of distress, you take a moment and help heal yourself. And we're going to go through resiliency do's and don'ts, but I'm going to start with the don't side of things. And the first don't is don't ignore early signs of burnout. We all have our different responses to stress, and we all react differently to times where we're unhappy or going through trauma or issues. And I myself actually I've created a resource for myself where I actually will outline the early signs of burnout, middle and late signs of burnout. And this is not scientifically studied by any means, but it's something that I've known to help me and I've used throughout residency. So for the last probably decade, I've kind of used this system where I've laid out for myself what are the symptoms of early, middle, and late burnout. And then I have interventions for each stages of those. And so, for example, an early symptom of burnout could be increase in number of typos. um, so it could be something really little, but once you kind of recognize it, you can watch out for it and say, hey, like, that's probably one of my early signs of burnout. I need to take a moment and take care of myself. A middle stage could be increase in irritability. Like if you feel like you're just a little bit more on edge than usual, that could be a middle stage of burnout. And a late stage of burnout, as an example, could be feeling like you have to sleep 10 hours a night every night of the week. And then your interventions at each of those stages could be things that you enjoy at each stage. So to try to get you back to the earlier stage and get you back to a better emotional place. So take care of burnout symptoms early on. Don't let them pile up because, as I mentioned earlier, we're running a marathon here. It's not a sprint. The second tip in resiliency don'ts is don't constantly check news or social media. And this also includes not checking the counts of coronavirus cases and deaths all the time. And I myself am guilty of this. Um, and yes, it is important to be informed, but you can limit that to once or maybe twice a day, or maybe only look up certain things when you have specific questions. Because if you're constantly checking news and social media, for many people, that can actually create more anxiety and doesn't help give them a sense of better control. And then lastly, on the don'ts, don't rely on excessive alcohol or other substances. Now, we've talked in various webinars on how alcohol is bad for our health, but it's incredibly bad for emotional health. And the reason why that is because it interferes with sleep. And you might say to me, well, Rosemary, like, what about nightcaps? You know, I can sleep better if I have a little bit of alcohol in the evening. And yes, alcohol might help you get to sleep sooner, but it actually interferes with REM and deep sleep. And these sleep stages are necessary for you to consolidate your memories and to also decrease anxiety. So sleep is actually kind of like natural Xanax. It's actually what we need to do for our brains to calm ourselves down and be able to deal with the next day ahead. So if you're drinking too much, you're actually interfering with the effectiveness of your own sleep. And on the do side of things, you absolutely still need to connect with others. I know that because of social distancing, we might not be able to connect physically, but luckily we're in an age where we have lots of digital options to connect, whether that be phone calls or a quick text or doing kind of group video chats socially. Be creative in the way you can connect with others, because venting or even just listening to others has actually been scientifically shown to reduce anxiety and depression. Second, we've talked about sleep, is that it is critical for you to get enough sleep during this time for your body to heal, but also for your mind to heal from the anxiety and any of the emotions that you're experiencing during the day. You might find that you need a little bit more sleep than usual. You have to listen to your body and create that time for sleep. Exercise is also a wonderful way to help decrease your stress response and help get your body and your brain functioning back to normal. Also, if you don't feel like doing a very strenuous exercise, that's okay. Getting out and walking and getting some sunshine will actually help reduce your stress response as well. Also, be mindful of what you focus on. Notice if you're focusing on, what you don't have versus what you have. Are you focusing on the negative side of things? Can you see the positive? Are you focusing on all the tragedies happening? What is your mind being focused on during the day? Because whatever you're kind of looking at is going to be what affects how you feel emotionally and how your body reacts to it. And then lastly, this is going to be our new normal for a while, and we have to be creative about still finding joy and doing the things that we love, or even finding new hobbies. So I really encourage you guys to take time to figure out what can you do to make the most of the situation. And for those of you who do have underlying mental health conditions, which by the way is at least 1 out of 5 adults in the US. So if this is you or someone you love, know that this is a very common situation. But if you are in this bucket, you have to make sure that you continue your treatment plan as laid out by your provider. You don't want to miss any medications or skip out on any therapy sessions, because you're going to need that support now, more so than ever before. If you do take medications, make sure you have an adequate supply. And if your provider can give you a little bit extra, depending on what type of medication it is, because you might not be able to get to the pharmacy, then please see what they're able to do. They might not always be able to do that given the type of medication, but do whatever you can to make sure you have a regular supply of the medications that you need. Also, ahead of time, ask your provider about whether or not there are going to be changes to their availability or the way in which they're going to hold sessions. Are they going to be video sessions instead? Or if video is not possible, can you connect by phone? Make sure you know the protocol in case you're having worsening symptoms. Who do you need to talk to in times of distress, and if you need support right away? Like, make sure you have that plan all laid out so you know what to expect. As I said, we're going through a lot of uncertainty right now. So whatever things you can plan out ahead of time so that you are more certain about those things, the better you're going to feel. And then lastly is, continue to monitor for new or worsening symptoms and you can go back to that slide on the early distress signs like changes in sleep or appetite, because those might mean that you're not doing as well as you were before. And if you have new or worsening symptoms, you need to talk to your provider right away to get ahead of it and have a plan in place for how you're going to deal with it. At United Ag, we are, very lucky to have a lot of resources to support you during this time. Our health and wellness centers are an excellent resource. If you're having any distress, you can call them and they'll help you out. And certainly Teladoc Health has not only the health resources, but also behavioral health services during this time. Our member advocates are, doing a fantastic job with helping to support you. I know a lot of you know them on a personal level, so you know the lengths that they go through to help you. And then lastly, our marketing team has compiled a wonderful webpage with comprehensive COVID-19 resources. This is probably one of the best compilations I've seen. And it really has all you need there. And we also have our newsletter that we send out. And so that way, if you need to kind of curate what kind of news you're ingesting, just go to these two things, the web page or the newsletter. And that's kind of your daily, not daily necessarily, but it's kind of your digest of the news. And that for, you're getting good information. And then lastly, I just want to end with a quote that I really love from Brene Brown, the author and professor. And she says, "I don't have to chase extraordinary moments to find happiness. It's right in front of me if I'm paying attention and practicing gratitude." I know for myself and for a lot of people I know, happiness is often created by going to events or looking outwards or even buying things. There's often a external source of happiness in our lives and society. That's kind of how we get happiness most often culturally. And right now, a lot of those sources of happiness are not available to us. But we're challenged during this time to realize that we can actually create happiness for ourselves intrinsically through our mindset and in what we pay attention to, and also cultivating more gratitude. And there's actually been scientific studies that have been shown that the practice of gratitude can actually decrease stress and certainly any response to traumatic events. And by gratitude, I don't mean kind of blanketly saying, "Oh, I'm thankful for everything that happens, even the COVID pandemic." I don't think anyone is truly thankful that this is happening to us. And it's also not a blanket positivity of, "Oh yes, I'm just going to be happy." That's not really what the gratitude is about. The gratitude is really about being thankful for what we do have, looking at the small joys in life that we still can experience, and also be thankful for the people around us. And with that, I am very thankful for all of you for joining me here today. I'm thankful for the United Ag family for organizing these health chats and bring the community together. So. And with that, we will go into questions.
Thank you so much, Rosemary. Please feel free to chat in your questions. We know that this is a sensitive topic, so we made it so that all of your chats are private and only Dr. Ku and I can see them. So feel free to ask your questions. Feel free to answer that poll. We know that this is a really difficult time. And personally, yeah, I've been feeling a lot of anxiety, and I just stop and think about how I do have a job and how I am okay right now, and that sort of helps me stay positive. So, Dr. Ku, are there any things that you specifically do?
Thanks for sharing that, Tiffany. Yeah, I actually do try to get out and walk as much as I can. That helps me, and actually, this is going to sound kind of ironic because a lot of you who've heard me talk know that I encourage people to limit their carbs, especially if they have chronic diseases. But I actually do a lot of bread baking, so that's my little kind of relaxation thing. And then I also do want to take a moment to mention that in the back and behind the scenes, we're working on bringing out a new behavioral health benefit. It's a company called Spring Health that we're working through the contracting and implementation process at this moment. So you'll get a lot more information later down the line, but it's essentially a very high touch behavioral health service where they would pair you with a licensed therapist who acts as your care navigator and holds your hand through the whole behavioral health journey. So you never have to worry about where you're going to seek care, how to schedule the appointments, or what type of care you need. They will basically hold your hand through all of that.
I'm really excited for that. So we have a question. Um, I'm feeling really tired lately. What should I do?
Uh, Great question. I think a lot of us are experiencing this right now. First of all, recognize that that's a very normal response to feel tired and fatigued. And I would say the first thing to do is try to rest and honor. If it gets to a point where you're sleeping so much or so fatigued that you can't take care of your normal daily responsibilities, then that's the time in which you should seek a healthcare provider for additional help. But if it's just that you feel tired, you need maybe an extra hour of sleep or a nap here and there, take that time for yourself.
And Rosemary,
Mhm.
we are seeing your text come in on your screen. So just,
Okay.
just a little heads up there. So I have another question. Um, I wanted to ask if cold showers work. I heard they're good for you. Would you recommend cold showers?
I think it depends on what time of day we're talking about. A lot of people like cold showers in the morning to wake up. At night, though, if you're trying to get to sleep, the recommendation is actually warm showers. And it's not necessarily just the warmth, but it's actually the transition from the warm shower to the cooler room that helps your body kind of calm down and get ready for sleep. So if it's at night, I would try warm showers instead of cold. But look, everyone's different. So if that works for you for either, de-stressing or decompressing, then go ahead and do that. But the recommendation for most people is warm at night because of the transition from warm to cooler to the cooler room.
I feel that many of us are feeling unmotivated. How do we keep each other and our teams motivated?
I wish I had a silver bullet for that. I think one of the best things to do is to for people to kind of voice their emotions and saying, "Look, I'm feeling angry, or I feel stuck. I feel dissociated from what's happening," or kind of talking about it, because the lack of motivation is a symptom. It's not a core problem. It's related to the underlying emotions that you're feeling at the time, which could be fear or anger, um, or just feeling uncertain can cause a lot of unmotivation, low motivation, and that's related to your stress response of freezing. That's essentially what you're doing, is freezing. You don't want to do anything to kind of potentially change things. And so talking about it can help. And as far as team functioning, everyone should just be more sensitive to each other during this time. And for managers to realize that their direct reports might not be functioning the same as they normally do because of these stresses, and to be able to address that and talk about it. And then also for direct reports to realize, look, their managers are humans too. None of us are perfect, and so we might not be acting like ourselves during this time, but to be able to talk about those emotions and support each other is probably the most important thing we can do.
All right. All the questions are coming in. So if I don't see it, feel free to chat it in again. I also heard that CBD creams on your neck is good. Would you recommend them?
I don't have a strong opinion either way on that. I think it's very individual as far as what works and doesn't work. So if it seems to work for you, then that would be a great option. But it's not something I would necessarily recommend across the board for everyone.
Okay. Um, One person writes, I think it's important to keep in mind that lack of sleep means diminished coping skills. Please address how we can recognize decreased coping abilities.
Yeah, I would say so these slides will be available, and on the distress signal slide, all of those are kind of slides of decreased coping ability. And those are probably a little bit more extreme than probably what you're asking about. Um, at least I know for myself, early signs of decreased coping ability are that I tend to react a little bit more strongly in the beginning. Like I'm less able to kind of take a step back and either be empathetic or go through the extra layer of thinking, oh, what does this person mean? Other kind of decrease in coping signs could be making small errors. Um, and that could be a very subtle sign of decrease in coping. Or it could be just forgetting things. And so actually the decrease in coping is very individual. So this is a great time to kind of take an inventory of seeing what's happening in your behaviors and is it different from before? If it is, then jot down what those differences are, and those are probably your own personal signs of having difficulty coping.
Is there anything I can do to curb stress eating during this time? Yes, please, Dr. Ku, answer that one.
Another thing I wish I had a silver bullet for. My best tip here is to just not keep unhealthy food around. A lot of us actually are quite limited as far as being able to go to the grocery stores, and even grocery store supplies are lower. So there might be less kind of unhealthy food options anyway. But keep around only the healthiest food because that's actually, important for your immune system. Also, trying to make sure that there's nothing that's highly processed or high in sugar in the house is really important because the blood sugar highs and lows won't necessarily help your stress response or make you feel better. They might actually make you feel worse. So the best tip is to just not keep around unhealthy food because if you're stress eating carrots, you're probably going to be okay. If you're stress eating Oreos, you're probably not going to feel so good afterwards.
Great answer. And this is one that's really hitting home for me. How do we deal or cope with cabin fever?
Mm. Okay, yeah, that's really hard, especially if you have kids or multiple members of your household. Um, I think my advice there would be to figure out what kind of outlets you can do in the house, like whether or not that be games or challenging activities, um, or even are there little areas where you can exercise in your house, so you have like a little kind of sanctuary in a corner where you can go to, like work out some excess energy and then go back to the rest of the household. Also, for a lot of us, even though we're in in home shelter in place orders, we can still go out. But I know a lot of us, even though we have that option, tend to not take full advantage of it. So if you do have the option to go out, get out for a walk as much as you can, 5 minutes here and there. But otherwise, try to set up dedicated places in your house that are specifically meant for working out that energy, or find challenging activities to do like puzzles or games.
Just a reminder to everyone, this is being recorded. We will post this up and you will be able to share this with everyone. How do I get my family member who is so afraid to even walk out the door when we live in an apartment with no space for exercise or backyard or front yard to take a walk around the block?
Um, so hopefully with the new mask wearing recommendations, that can help with some of the anxiety. I know not all counties are making it required when people go out to wear masks, but if you are in a place where a lot of people do wear masks when they go out, that should offer some level of comfort. Um, Also, with the way this virus spreads, it's still through droplets. So as long as you can, maintain the social distancing, if you're out in the open where there's lots of air movement, there's ventilation, the chances of you contracting the virus are actually much lower than if you were stuck in a small room with someone right across the table from them, like 1 foot apart. And so there's a different level of risk to, walking out that outside and being outside that's much lower. Also, the benefit of being able to go out, get fresh air, get some sunshine and physical activity, those are all really important things for decreasing your stress response and also helping with your emotional resiliency. And as much as you can decrease your stress and achieve greater happiness, that actually helps your immune system. So you just kind of have to weigh the pros and cons and then know that, the virus is not thought to be spread airborne at this point. It's still droplets. So it's actually not nearly as dangerous as it could be if it were airborne.
What tips do you have when you're feeling overwhelmed by so many things at once?
I've definitely had periods where I felt like that. I know of close friends who have felt like that. And what I've seen work for myself and others is to just break out all the things. So literally do a brain dump of everything that has to be done, and then prioritize them in like kind of big sections, and then in each big section just break it down into small steps. And so therefore you can kind of tick off little things as you get them done, and even if it's something like take out the recycling, you can do that in a matter of minutes, but you've actually ticked something off your list, and gives you actually a sense of accomplishment. And so if there's an overwhelming list of things that you have to do, whether that's work or personal, if you can break it down, lay it out, and then just like attack them one by one, that usually helps a lot of people cope.
Are there any tips for helping the feeling of being completely helpless during this time when so many people are not doing so well?
Yeah, that's really hard. The feeling of helplessness is normal in this situation, right? We can't see this virus. There's so much that's not within our control, um, and so this is why social connection and being able to talk about those feelings is critically important, because you can't change the state of affairs, right? I can't will this coronavirus to go away. And therefore, because I can't change that, I have to be able to accept it. And part of accepting it is to talk about it and listen to how others talk about it and being able to vent. So, for a lot of people, those kind of social interactions, remotely, of course, can help with that feeling of helplessness. And at the very least, throughout those kind of social interactions, you realize that you're not alone in this.
Um, for those of you who might be having trouble chatting in your questions, be sure that you're chatting to the host and not to everyone. So we've made chats private because we know that some of these questions might be, you might feel uncomfortable asking this publicly. So try chatting in privately to me, and I'll see that.
Oh, and I apologize. I haven't been kind of looking through some of the private messages, but I'm scanning them really quickly now. And there's actually a really good one, and it's talking about your monitoring of your own symptoms. Because right now, I think everyone is kind of really vigilant about, what kind of new things are they feeling, and anything new, there's this sense of stress that, oh my gosh, is it COVID or is it just something that's really benign? Um, and I understand that stress, and it's very natural to have. Uh, but the things to remember there are, um, even if the symptoms are mild, you're still, if you, as long as you still are wearing a mask in public, you're not going to be spreading it to others. So that hopefully will create some sort of comfort. If these are symptoms that you've had on and off for a long time, like sneezing, it is also allergy season. Or if you normally get like a little bit of scratchy throat with your allergies, just think back like, oh yeah, I've actually had this before during this time of year, or I've had these symptoms for months. So just like consciously say like, hey, like this is actually not something short term. This is something I've had before, and I know what that is. And most likely it's not COVID. But I understand that fear of any little change can create a lot of anxiety. And certainly if you are experiencing new symptoms, or if you have the standard fever, cough, shortness of breath, you should absolutely talk to our health and wellness centers, or teledoc, and just get a professional opinion there. So we are there for you, so you don't have to always self-triage. But if these are things that you've experienced before or have been experiencing on an ongoing basis, take comfort in the fact that most likely it's not COVID.
I have another question, unless you want to go through yours.
Oh, no, go ahead.
Okay. During these times, I personally am lost as to my own symptoms. Things change every day. One day I'll have a sore throat, then tired. Other days I have stomach issues. Trying to figure out the difference um, between my fear of having something or being anxious. That's a good one.
Yeah, that is a good one. And that's kind of similar to what I was just saying, is that if you know you've had these kind of symptoms before, and they typically kind of wax and wane, like they come and go, uh, then that's more likely related to anxiety, or your underlying thing like allergies or digestive issues. If it's something that starts abruptly and kind of gets worse, then it might be something that you need to talk to a healthcare professional about. But anything that kind of comes and goes, or is kind of typical from what you've experienced before during stressful situations, is most likely your body's normal response to stress.
Do you have any other questions on your end, Dr. Ku?
Yes, there's a question on how long these droplets stay on surfaces. Um, and so the data before has shown that the droplets can be in the air for a few hours, and then on cardboard can be about a day, and then on stainless steel and plastics for about 3 days. Um, but this is not necessarily the main way in which we think that the virus spreads. So even though potentially you could get sick if you touched some item that had the virus on it, we don't think that's the main route of spread. We still think the main route is basically from um, the droplets getting on you, or you touching something that was recently coughed on and then you touched your face. But continue washing hands. I mean, I know that can create a lot of dryness. I know it's kind of annoying, and it takes time. But still keep on doing it though. Um, yeah.
I have one. Do you recommend any books? Brene Brown is someone she mentioned, and I thought maybe you had better recommendations.
Brene Brown is great. I actually love this book called Why We Sleep. And I literally have it on my bookshelf right now. So it's by Matthew Walker. And I know the title sounds boring, but it's a wonderful and very easy read. And it tells you all the reasons for why sleep is critically important, not just for your physical health, but they also talk a lot about mental health.
Can you repeat the name of the book again?
Why We Sleep.
Why We Sleep. Great. Does anyone have any more questions? We'll give you guys a couple more minutes. Anything on your end, Dr. Ku?
No, I think we covered a lot of ground. If you all...
Whoa, I have one more.
Oh, okay.
Do we want to stop? Let me stop sharing your screen. And then maybe, oh, you're good. Okay. I'm taking care of it. I'm taking care of an elderly parent. Should I be wearing a mask? All I do is go to the grocery store with a mask.
That's challenging. The reason I'm pausing is because I'm thinking through how the latest data shows that there can be spread even if you don't have symptoms. If the person is, elderly or has chronic conditions, if you're going to be in close proximity to that person, meaning less than 6 feet for a considerable amount of time, I think given our current knowledge, I would probably recommend wearing a cloth face mask because even if you're feeling okay, there's a chance you might have the virus and could potentially spread it.
I have a question about what we're going to do with the polling. We just want to get a sense of what you're all feeling. And if we see some correlation, we'll, try to provide more resources based on that. And I'm not getting anything else. Are you, Dr. Ku?
I just got a question of what's the best way to sanitize the cloth face masks? Just put them in the laundry, if that's easy, or you can just wash them with soap and water.
Great. If you guys think of any other questions later on, we do have an email for Dr. Ku, askdrku@unitedag.org, and I will chat that so you all have that. But feel free to email her and she will send you a response. But please keep in mind, this is for general health questions. It's, if it's an emergency or something like that, you should still see your doctor. But ask Dr. Ku at unitedag.org.
Great. Thank you, Tiffany, for helping to host this webinar, and thank you all for joining.
Thank you. It's always a pleasure. Have a great weekend, everyone.